Hello, I'm Katharine O'Brien, the host of the Autism Goes to College podcast, and on this episode, we're doing something just a little bit different. I spend my days on the campus of University of California, Riverside, where I'm an autistic PhD student researching the spectrum. I teach students who are going to be educators, and some of whom are autistic themselves. And there's been a lot of questions and confusion on campus this summer and fall in ways that I did not imagine myself encountering when I started graduate school a couple years ago. So, to discuss some of that, I've invited on my advisor, Dr. Katherine Meltzoff, who is an associate professor of education and the director of the Search Family Autism Research Center, the clinic at which I work at UC Riverside, to have a conversation about what we're doing and what we can do to meet the moment and try to push forward the work of helping students with autism and families, um, even though things have gotten a little confusing. So, Katherine, Dr. Meltzoff, thank you so much for joining me.
Yeah,
All
thank you
right.
so much for inviting me.
So let's start really broadly. We're both on campus and working in classrooms or in the clinic as well. And we're hearing how the information or maybe disinformation that's being put forward by the Department of Health and Human Services, the Secretary, Robert F. Kennedy Jr., is impacting the questions and concerns that are being brought to us, both about the potential causes of autism and the potential ways that autism could be supported or treated for a child. So, what does this mean for families and for us as people who are working in this space?
Yeah, that's a really good question. I feel like there's just so much confusion right now.
Yeah.
Everyone seems to be talking about autism in a way I haven't ever really heard before. There's a lot of distrust, mistrust about kind of what doctors have to say or what professionals have to say, and there's a lot of feelings being shared about why wasn't this told to us earlier? Why didn't we know these things? It's been kept secret from us. Like just a lot of bad feelings about how things have been done in the past and a lot of thoughts about how they should be done differently in the future. And it's been really hard to sort of cut through some of that noise, I think, and give people the right information.
And I think to me, I always assume some of this fear and worry is coming from the increase in autism diagnoses and the prevalence rise. And I kind of want to personalize that question a little bit. Just talking about the changing diagnostic criteria. Right now, like I qualify for a diagnosis of autism spectrum disorder, and it's accurate to say I'm autistic. But 20 years ago, the diagnostic criteria were such that I would have had a label of Asperger's syndrome, a label that was taken out of use when we made the jump to the most recent version of the diagnostic manual. And then 40 years ago, the diagnostic criteria were really, really narrow, and I probably wouldn't have had a diagnosis at all. Of course, I also wouldn't have existed. I'm not 40 yet, but had I had a time machine, And so let's talk about that and so how that can create kind of confusion for the average person and for families.
Yeah, I'm really glad you brought that up, honestly, because I think that is one of the biggest drivers of this fear and this concern that parents have. Like, I have to do something. I have to do something. This is an epidemic. It's rising and rising. And I think there isn't enough attention paid to the fact that first of all, autism spectrum disorder or autism did not exist as a diagnostic thing until 1980. That is not a very long time ago. So before that, it was considered a sub piece of childhood schizophrenia, which we now
Yeah.
know it is not at all. So, and the criteria in 1980 were incredibly strict. Like you had to have what they called gross deficits, quote unquote, in all these areas, in language, in you had to have bizarre, quote unquote, responses to people. Um, it had to be before 30 months of age. So a lot of people, and I think KOB, you rightfully identified yourself as one, a lot of people who today we think of as having autism spectrum disorder, being autistic, would not have gotten that diagnosis in 1980 because the criteria were so strict. It was capturing
Yeah.
like a a really tiny subset of what today we would consider kind of the most severe cases of autism, the kids that are the most affected, the most impacted, have the highest support needs. It was capturing those children, but missing
Yeah.
the entire rest of the spectrum.
You know, in my class this summer, when I last taught, we hadn't had some of the more recent news, but there was talk that the cause of autism was going to be published soon. And I talked to my students about why I didn't think there was likely to be a single cause. And also, I hypothesized at the time that I thought they might re explore the dismissed link between vaccines and autism. So I got a lot of questions from students about vaccines over the summer, both about how vaccines are made and how they work, and how we know they're safe and effective, and why we know they're not linked to cause autism. But I'm wondering if you're seeing that too, and what kinds of questions you're getting about autism in your teaching practice now, if it's changed.
Yeah, I feel like there was 10 years or so, and maybe I've been at UCR 10 years, so I'm going to just say the whole time I've been at UCR, basically, I haven't had anybody ask me about vaccines and autism because it's been studied so many times since the first fraudulent study in 1998
Mm-hmm.
that linked them in the first place. That was
Yeah.
retracted, it wasn't accurate, and then it's been studied since then over and over, and there is no causal link whatsoever. And unfortunately, now we're kind of going back to wondering if there's a link because when people talk about autism recently, they also are talking about vaccines. And that is unfortunate because there just isn't a causal relationship there.
Yeah. The most recent studies that are well statistically controlled actually find that there's a slight inverse association where children that are fully vaccinated are a tiny bit less likely to be identified as autistic, which goes to show that statistics can easily be misinterpreted, but also that this really is a settled issue and that it had kind of gone quiet for a while. So are there other things that have sort of spun back up, or are there new questions?
I feel like for a while, like I said, there was no talk of vaccines, but when there was talk of vaccines, maybe in like 2005, 2006, 7, when the retracted study was still more recent, it was only talking about the measles, mumps, rubella vaccine or the
Mm-hmm.
MMR. Now
Yeah.
somehow we're talking about all the vaccines. Like I've heard a lot of talk that I've never heard before, questioning every vaccine. The
Yeah.
chickenpox vaccine, the Hep B vaccine that's recommended early in childbirth, like the day after birth. And it's seeming like it's coming.
Vitamin K.
Yes, yes. It seems like it's coming in this
Yeah.
strange circle where now we're re litigating, so to speak, issues that have been settled, which again is concerning.
Yeah. I certainly was concerned when my students were not really sure what the mechanism of vaccines were or how they were discovered, although I was definitely happy to teach them about that. What are you finding that the students in your classes understand? Are they debating? Are they on all different points of view, or are they pretty accepting of what you're teaching?
It seems like they're pretty accepting. I think the bigger resistance or the bigger skepticism, I guess is a better way to say it, comes from families who are truly, truly convinced that their child was developing in a neurotypical way, and then they got their 12 or 18-month vaccines, and everything
Mm-hmm.
changed.
Yeah.
And and that is something that they feel is true, and it is essentially impossible to convince them otherwise. And
Mm-hmm.
the more people who feel that way, which is a valid feeling to have, but the more people feel that way and the more it gets discussed, the more it seems like something that's a likely cause as opposed to, again, something correlated in time, like the
Yeah.
emergence of first autism symptoms with vaccine age, as opposed to a causative relationship, which again, there just is not.
Yeah, and that is similar to the question of acetaminophen, where, you know, the child is experiencing a huge burst of development that makes them able to receive vaccines and also able to exhibit symptoms of autism. And unfortunately, those are happening at the same time. Um,
Yeah.
I know I made a couple changes to my syllabus just in terms of covering vaccines more heavily and assigning an article that was newly published, continuing to explore the completely discredited link. But have you made any changes to your syllabus or to your courses in response to what's going on?
I think I will be. When the next time I teach my undergraduate class, I think I'm going to be assigning that that giant study, I think out of Denmark, where it's like 2.5 million
Yeah,
people. Um,
that's the one I
yeah,
assigned.
I mean, it's the
It's
biggest.
every child born in the country for about 20 years. And
Yeah.
because they have a national health service, they have incredibly complete data.
Hmm. And
So
they,
it's really compelling.
yeah, and the data they present is quite complete. It's really carefully done. It's statistically accurate, and it makes it pretty clear that there just isn't a link. And so I do think
Yeah.
I'm going to be probably assigning that. I also might talk about the review about acetaminophen and autism that was discussed by HHS a bunch recently.
Mm-hmm.
And that review was kind of touted as like proof that there was a link, but that's not what that review actually said. And that's not actually what the review
Yeah.
found. So that's
Yeah.
concerning. And I think it leads me to think that there needs to be a lot of discussions about how to interpret those scientific papers and how to interpret review papers and what review papers are and what they can and can't do and can and can't tell us.
Yeah.
So I'm rethinking
Absolutely.
a lot of those things.
Are, is it changing any of the research side of things in terms of grants we're working on? Or I haven't even thought about this yet, really, for my own research. But I'm wondering if it puts some new directions on our work as researchers in terms of supporting media literacy for families or things of that nature.
Yeah, I mean, I definitely think it could change direction in terms of kind of public health outreach grants, like grants that are designed to provide education to families, to individuals who are supporting autistic people, to families who have questions and concerns, to self advocates. Any of those grants that are designed to be outreach and educational, I think including, like you said, media literacy, kind of scientific paper literacy to the extent that you can read the abstract of a paper and kind of understand what it does and doesn't say.
Mm-hmm. Yeah, and
That would help.
even educating people that many scientific papers now publish a lay abstract, which I think a decade or two ago was not the norm, but
No.
the changes that we've made as scientific communicators to try to make our work more accessible are not very meaningful if people don't know that those resources exist.
Yeah.
Um, so yeah, definitely have spent a lot of time in grad school working on plain language summaries of my work because I feel strongly that it should be accessible to the autistic community so that it is most useful.
Yeah.
um,
I mean, I think as
yeah.
scientists, if we don't do a good job of disseminating our work and of telling people what we're doing, what we found, what it means, why it's important, what the limitations are of the research that we do, I think that is something that ethically should be happening with every study. I think a lot of us as scientists like don't want to admit that our findings could be wrong, but we should.
Yeah.
Like just
Yes.
because one paper found one thing one time does not make it a pillar of scientific truth. Papers can be
Yeah.
wrong, even if they were done ethically and correctly. Findings can be wrong.
Yes, or yes, a result can be explained by something that was not accounted for in the study.
Yep.
Um, I remember very early on in my scientific career realizing that we had bred a mouse line as a model of a neurological condition, but we accidentally bred in a mutation that had completely confounded the result of our study, and it was useless. And that happens,
Yeah.
and sometimes you don't catch it.
Yeah.
um,
And I
So
think when papers try to do those things and make those controls and take those steps, that's something that should be emphasized a lot more to lay people.
yeah,
Like for example, in
yeah,
the one of the big studies of acetaminophen and autism, actually they found an association, so a correlation between
hmm,
acetaminophen use and autism. But then when they actually controlled for family factors and genetic
yeah,
factors, meaning is there a sibling in this family with autism? And they looked at sibling
yeah,
pairs where the mom took acetaminophen in one pregnancy and not the other. Like they did these things to control for family factors. Once they did that, the association was gone. And I feel
yeah.
like that doesn't get enough attention. Like people look at the big headline and don't look at the analyses that come later that tend to be more careful and more deliberate.
Yeah, absolutely. And frankly, a lot of those statistical methods are very advanced. So, people who, even with an undergraduate level of education, it's hard to understand those analyses. And that's part of why, as scientists, it's really important, like you said, that we communicate. Um, you know, the publicity on autism can feel like a double edged sword because it's taking a lot of energy to address fears and concerns that we didn't used to have to address and that maybe are not as linked to what we know as academics. Like, it's definitely affected my mental health to some degree. I've taken advantage of our on campus short term counseling service just to kind of vent about how it makes me feel sometimes. And, if you're a student on campus, you probably have a similar resource. So if it's making you feel upset to hear these things, I encourage you to do the same. But I do think, and we've talked about the fact that there is kind of a silver lining here that autistic individuals and their families who are dealing with what is sometimes termed profound autism, although whether that is the right term, I think is still a subject of debate in the field, who really have 24/7 support and care needs and really have a lot of gravity to their challenges related to autism are feeling sort of heard and witnessed in this moment in a way that they haven't felt seen before. So what do you hope might come out of that?
Yeah, I think that is been a massive silver lining, I will say. I feel like, especially with the increased awareness of neurodiversity in the last, let's say, decade or so,
Yeah.
I feel like some parents have felt like the more, like paradoxically, the more acceptance there is for autism as a difference, not a disease, not a disability, I think some of those parents feel like the children that they have with these very profound support needs and 24/7 care needs, they feel like their children are sort of invisible because for
Yeah.
them, in their lived experience, the challenges that their child has are disabling in their mind
Hmm.
because there's safety issues,
Yeah.
there's severe aggression, there's complete lack of sleep. Um,
Yeah.
it's really serious, and so I think the fact that those parents feel heard and the fact that there's more attention paid right now anyway to the community of what we're calling profound autism is really important because in some ways the DSM-5 when we erased Asperger's and what was called pervasive developmental disorder not otherwise specified or PDD-NOS by lumping everyone together in one spectrum there was a sense that sometimes the people who needed the most support were just getting forgotten.
Yeah. Because while the intention was to limit confusion between different doctors diagnosing people with different things, you know, every single day I have a lot less disability related support needs than somebody who is not able to speak, is not necessarily able to keep their body safe, is not necessarily able to feed or have basic hygiene for themselves, and that is the reality for some autistic people. And I think we need to talk about that.
Yeah.
That said, it's relatively rare for people with those needs to attend college. So bringing it back to the topic of this podcast,
Exactly.
how do you see all of the current publicity and public disinformation impacting a misunderstood population, which is autistic students on college campuses? What do you think might happen next?
Yeah, so I think this is the other side of the double-edged sword, right? So the families who feel seen finally, that's a silver lining. But the what you're talking about is the, I think, negative effect that's happening for autistic college students, autistic people in the workforce, autistic people who have families and have jobs and, live their
Might be
lives.
planning to have a baby,
Yeah.
frankly. I
Yes.
worry about somebody who's thinking about planning a pregnancy
Yeah.
in this moment and is autistic.
Yeah. And who feel
Yeah.
who feel as though their lives are fulfilling and meaningful and don't want a cure, quote unquote, and don't want to
Mm-hmm.
feel marginalized and don't want, people talking about them as though they have some horrible condition because they don't. I think that's that's the other thing we have to talk about, which is that for those people, it's invalidating, it's harmful, it's insulting, it's demeaning. I could go on. It's really
Yeah.
bad.
Those are all emotions and frustrations that I have worked through. Wondering if this is the dawn of new American eugenics against neurodivergent individuals, things of that nature. It's all heavy emotional weight. And I think all of us know that college students perform best when they feel supported and accepted. And this works against that for autistic college students, which is a real shame in my
Yeah.
book.
Yeah, I think it works against it. It also works against what the neurodiversity movement has worked so hard for over the last decade, which is to feel acceptance and support
Mm-hmm.
and validation and
Yeah.
valued, which everyone should be. And so that's the problem with assuming that autism is something that has to be treated or is so, terribly profound. I've heard language like it tears families apart. And that's really harmful
Yes.
as a statement
Yeah.
because the
I
spectrum
mean,
is
I
not one
think,
thing. We have to be aware of what it is.
yeah, I think it can just as easily bring families together to support and understand each other.
Yeah.
Certainly the better I understand myself, the more closeness I experience, and my family listens to the podcast. So yeah, I hope that this is an opportunity for people to connect and be empowered and kind of seek out the facts, even if they're a little harder to come by.
Yeah.
Um,
That would be
yeah.
my hope. And I think also just to recognize how wide and diverse the spectrum is. Maybe it's just a reminder for all of us that perhaps putting everyone into one label, although meant well and done for good reason, might still not be the right move. Like
Yeah.
it might not be the right thing, and that autism is not one
Yeah.
thing.
I totally agree, and I think that there is interesting research that's starting to work on that. And although I am not directly involved in the American Psychological Association deciding on the guidelines, I kind of expect that they will re-segment autism to some degree. And
Yeah.
yeah, I wonder if this move will kind of fuel that and give some more energy to trying to get it more correct this time.
Yeah, I definitely think there's a huge push, at least for segmenting what we were calling kind of profound autism into its own label. Because again, of the
Yeah.
amount of support needs, the amount of 24/7 care that is necessary for that subset of the population, small as it may be, there are a lot of needs. And so I think this might push the APA
Yeah.
to change that labeling again.
Yeah. That's certainly one thing that I'm hoping may come of it, although it's too soon to know for sure what the impacts and outcomes will be.
Yeah.
Well, yeah, so tough stuff, but a lot of interesting potential as well. Thank you,
Yeah.
Dr. Meltzoff, for kind of cutting through some of the noise with me today.
Thank you. I think these conversations are just incredibly important because people don't know what to think and they're hearing different information from different sources. And it gets to a point where you get information fatigue and just feel like you don't want to
Yeah,
hear anything anymore. So I think these are just necessary conversations to have and to publicize.
absolutely. I couldn't agree more.